New-onset diabetes after 50. Could this be pancreatic cancer? Hello, this evidence-based content is prepared by Saboor Fellowship-trained consultant surgeon. And if you or someone you care about has recently been diagnosed with diabetes after age 50, you're in the right place. I know getting a diabetes diagnosis can feel overwhelming enough without worrying about what else might be happening in your body. But today we're going to talk about something your primary care doctor needs to know about, and something that could genuinely make a difference in catching a serious condition early. Before we dive into the connection, let's establish what we're dealing with here. Pancreatic cancer-associated diabetes is exactly what it sounds like: diabetes that develops as a result of an underlying pancreatic cancer, rather than the typical type 2 diabetes most people develop. Now here's why this matters to you personally. Up to 25% of pancreatic cancers are heralded by new-onset diabetes. That means diabetes diagnosed within the previous 2 years or less. Let me give you the data, because it's important to understand the scope here. According to research comparing patients with newly diagnosed pancreatic cancer to similar age controls, diabetes was far more prevalent in cancer cases, 47% versus just 7%. But here's where it gets really interesting. Among those pancreatic cancer patients who had diabetes, 74% had been diagnosed within the preceding 2 years, compared to only 53% in the control group. Now, what does this look like in real terms? If you're over 50 and you've just been told you have diabetes, despite maintaining a reasonable weight and not having major risk factors, this temporal pattern matters. The research shows that after surgical removal of the pancreatic cancer in one study, diabetes actually resolved in 57% of patients with new-onset diabetes, while remaining unchanged in those with long-standing diabetes. This tells us the cancer itself was causing the diabetes. Now you might be wondering, does diabetes cause pancreatic cancer, or does pancreatic cancer cause diabetes? The answer is actually both, but in different ways and time frames. Research demonstrates that long-standing type 2 diabetes, abnormal glucose metabolism, and insulin resistance are etiologic factors for pancreatic cancer, meaning they can contribute to causing it over many years. One prospective study followed people for up to 16.7 years and found that higher fasting glucose and insulin levels, as well as insulin resistance measured at baseline, significantly correlated with developing pancreatic cancer more than 10 years later. The hazard ratio, that's a measure of risk for those in the highest quartile of insulin levels, was 2.90 compared to the lowest quartile. That means people with the highest insulin levels had nearly 3 times the risk. But here's the critical distinction. New-onset diabetes in older adults appears to work differently. Evidence suggests that a growing pancreatic tumor can actually induce diabetes through paraneoplastic mechanisms. That means the cancer itself triggers metabolic changes. One fascinating possibility from laboratory work is that pancreatic cancers might shed tiny particles called exosomes, containing a hormone called adrenomedullin, into the bloodstream, which can cause beta cell dysfunction and inhibit insulin secretion. Here's something that might surprise you. Analysis from the Nurses' Health Study and Health Professionals Follow-up Study found that the risk of pancreatic cancer was particularly elevated within the first 8 years after a type 2 diabetes diagnosis, but then decreased thereafter. The research showed that levels of C-peptide, that's a marker of your body's own insulin production, fell beyond 8 years after diabetes diagnosis, suggesting a central role for high insulin levels, specifically in the earlier pancreatic cancer risk period. A third series from the Mayo Clinic provided crucial evidence about early detection. CT scans performed at the time of newly diagnosed diabetes in otherwise asymptomatic patients were more likely to show potentially resectable tumors, meaning tumors that could be surgically removed, compared to scans performed just 6 months later. Now, what does this tell us? When you catch these tumors at the diabetes diagnosis point, there may still be a window for curative treatment. CT screening of all older adults with new-onset diabetes isn't feasible. The numbers just don't support it from a public health perspective. But research suggests that pancreatic cancer risk is especially elevated in older adults with new-onset diabetes, who have a previously healthy weight and otherwise unexplained unintentional weight loss. Let me paint you a practical picture. We're talking about someone who's been relatively fit their whole life, maintained a reasonable body mass index, let's say someone who's 5 feet 9, and has consistently weighed around 165 pounds, and then they develop diabetes at age 55 or 60. If that same person is also experiencing unexplained weight loss, maybe dropping 10 to 15 pounds without trying, that combination should prompt immediate further investigation. Now, I know when you hear these numbers and scenarios, it's natural to feel scared. These concerns are completely normal and understandable. But here's the perspective you need. Pancreatic cancer affects approximately 13 in 100,000 people per year. We're not talking about something that happens to everyone with new diabetes. We're talking about identifying the subset who need more evaluation. First and most importantly, if you're over 50 and have been newly diagnosed with diabetes, especially within the past 2 years, have an honest conversation with your primary care physician about your personal risk profile. Here are the specific questions to ask. Given my new diabetes diagnosis and my age, what's my risk profile for pancreatic cancer? Should we consider imaging of my pancreas? I've read that unexplained weight loss combined with new diabetes can be a warning sign. Your doctor should be checking for additional warning signs. According to current clinical practice guidelines, for high-risk individuals, monitoring of fasting blood glucose and hemoglobin A1C should be considered at baseline and with continued surveillance. If you have new-onset diabetes and you're in a higher risk category, urgent imaging within 2 weeks with endoscopic ultrasound (MRI) or a pancreatic protocol CT scan should be performed to evaluate the pancreas. You need to know the warning signs that mean get evaluated now rather than mention it at your next visit. Seek immediate medical attention if you develop jaundice, that's yellowing of your skin or the whites of your eyes indicating possible bile duct obstruction. New or worsening abdominal pain, particularly pain that radiates to your back. This occurs in a significant proportion of cases. Unexplained weight loss continuing beyond your initial diabetes diagnosis. We're talking about losing more than 5% of your body weight without trying. Now I need to be clear about current guidelines. Screening for pancreatic cancer is not warranted in older, otherwise asymptomatic adults with new-onset diabetes. This recommendation comes from the United States Preventive Services Task Force, which specifically recommends against screening for pancreatic cancer in asymptomatic adults not known to be at high risk because of family history or inherited genetic syndromes. However, and this is crucial, if you have additional risk factors, you may fall into a different category. High-risk individuals include those with a family history of pancreatic cancer, particularly if you have 2 or more first-degree relatives with the disease. Known genetic mutations such as BRCA2-ATM or PALB2 pathogenic variants, hereditary pancreatitis, certain hereditary cancer syndromes. If you're supporting someone through this, encourage them to discuss their complete family history with their doctor. Many people don't realize their family cancer patterns might put them in a higher risk category that warrants screening. Even while you're pursuing medical evaluation, you can take control of modifiable risk factors. According to the 2017 Global Burden of Disease study, deaths related to pancreatic cancer worldwide were primarily attributable to smoking 21% high fasting plasma glucose, 8.9%, and high body mass index, 6.2%. If you smoke, stopping is the single most impactful action you can take. Research shows the excess risk falls by 48% within just 2 years of quitting smoking. You can do the math right, that's nearly half your risk gone in 24 months. Manage your diabetes aggressively with your healthcare team. Work with your doctor to achieve good glycemic control. This typically means aiming for a hemoglobin A1C below 7%, though your personal target may differ based on other health factors. Address excess weight if present. Obesity contributes to 6.2% of pancreatic cancer deaths. If you're carrying extra weight, even modest reductions help. We're talking about losing 5 to 10% of your body weight, which for someone weighing 200 pounds means 10 to 20 pounds. That's achievable through sustainable dietary changes. Think Mediterranean-style eating with grilled fish, olive oil, and plenty of vegetables, about 1.5 cups per meal of non-starchy vegetables. Incorporate regular physical activity. The recommendation is 150 minutes per week of moderate activity. That's 30 minutes on 5 days, and moderate means brisk walking at a pace where you can talk but couldn't sing. You should see improvements in your insulin sensitivity and blood sugar control within 2 to 4 weeks of consistent activity. Let me quickly recap new-onset diabetes after age 50, particularly when combined with unexplained weight loss, in someone with previously healthy weight, represents a potential warning sign that warrants discussion with your doctor. Your next step: schedule an appointment to review your risk profile and determine whether imaging or closer monitoring is appropriate for your situation. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. All links are available in the description below. American Cancer Society Pancreatic Cancer Early Detection and Screening Guidelines. National Comprehensive Cancer Network, NCCN Pancreatic Adenocarcinoma Guidelines. Pancreatic Cancer Action Network Risk Factors and Symptoms. Up-to-date patient education. Pancreatic cancer beyond the basics. American Gastroenterological Association Clinical Practice Update on pancreas cancer screening in high-risk individuals. Thank you for watching.